common question that I will get for patients who are noticing volume loss is, what is the difference between facial filler and free fat transfer, where we use the patient's own body fat to replace areas of volume loss in the face? The main difference is going to be that a facial filler is typically made from hyaluronic acid and is a gel type substance. They come in various forms or consistency, and those fillers tend to be more temporary than a fat transfer would be, for example. And those fillers tend to last 6 to 8 months. However, I can tell you, as a surgeon who's performed facelifts for many, many years, I have seen filler in the facial tissues during a facelift procedure that was placed many years prior in that area and never fully resorbed. The thing about facial fillers that patients should know is that if it's a hyaluronic acid filler, it can be dissolved with an enzyme called hyaluronidase. And so that's one option that patients prefer, because if they would like to have that filler dissolved in the future, it can be, as compared to free fat transfer from that patient, which integrates with their own tissues because it's their own body fat and provides a more long-lasting result, but ultimately would be very difficult to remove if need be. Now, in the right surgeon's hands, who's performing the proper technique, the goal is to never have to remove, your own body fat when it's placed in the proper manner, in the proper layers of tissue in the face. Sometimes patients like to choose hyaluronic acid filler because it can be used to test how you might look ultimately with free fat transfer, or for example with a permanent chin implant. And once they see the results from a facial filler, they may choose to opt into a more permanent procedure in the future.